Hello, everyone. Thank you all so much for joining us today for this culinary medicine webinar. We will get started in just a moment, but first, you see two QR codes on the screen. Those are for our pre-event surveys. I will also drop those links in the chat for you shortly. We have one survey for patients and caregivers, and one for our healthcare providers in attendance. So if you could just take a brief moment to complete those, whichever one applies to you, we'd really appreciate it. And we'll give everyone just another moment to join. All right, I think we can go ahead and get started. I'm very excited to dive into today's topic on celiac disease and brain fog. And we, of course, have a fantastic group of speakers joining us today. And again, for those of you who just joined, we have these two QR codes on the screen for our pre-event surveys. And I also do have those links available now in the chat. So please complete those, whichever one applies to you as we get going here. And just before we get into it too much, I just want to begin with a few housekeeping items. So first, a big thank you to Schär for their generous support of sponsoring this culinary medicine webinar. We truly do appreciate their support, as this would not be possible to provide this session to you without them. There we go. And also, we do have live translations available in both Spanish and Portuguese. And to access that feature in Zoom, click that globe icon that should be towards the bottom of your screen and select your preferred language. You'll then be able to listen to the presentation through one of our live interpreters on the call with us today. And for our healthcare providers joining us who would like to claim continuing education credit, here is some important information on that. I'll just review these instructions again at the end of the session as well, but you're also welcome to reach out to me afterwards with any questions. And here are these instructions. If this is your first time attending, you'll need to register and create an account through Boston Children's Hospital using that link on your screen. And once your account is set up, you'll use your mobile and phone number, make sure that's included in your profile, and text that code on the screen to the number shown to log your attendance today. And if you've joined us before and already completed these steps, you can simply text that code to that phone number and you'll receive a confirmation once your credit has been awarded. And you can also download your transcript by logging into your account. And also for our dietitians, just a quick note, the documentation that you will receive is a transcript, which may look a little bit different from the traditional RD certificates you may be used to receiving, but it is acceptable for CDR documentation. And again, I will be sharing all of this information at the end, and you can also, I'll also place this in the chat shortly as well. But if you run into issues or have any questions regarding CEUs, please don't hesitate to reach out. But today's topic, again, is on From Fog to Focus, Culinary Strategies for Brain Health in Celiac Disease. And we are joined by an excellent panel of speakers. And as with all of our culinary medicine webinars, you'll hear from a gastroenterologist, a registered dietitian, and a medical chef, really bringing in a variety of expert perspectives. And we may have some time towards the end for our speakers to take some of your questions. So if you do have a question, please send it our way using the Q&A button towards the bottom of your screen. So with that, I am delighted to hand it over to our first speaker, Dr. Ritu Verma, to get us started on our presentation.
Thank you, Emma. It's obviously fantastic to be here. I think I'm just going to share my slides. It's always a pleasure to talk about celiac disease at any time. And then, of course, a pleasure to, and I think this is a topic that we probably don't have a whole lot of conversations in our clinics. We don't have that much of a conversation. I know the patients have conversations, but probably we don't as providers. Hopefully you can see the slides. So the focus today is brain fog, but just going to go over some more general sort of things. I think we all know, if we are here today, that celiac disease is a systemic autoimmune disorder. And we know it's triggered by gluten in genetically susceptible individuals. And that I think everyone knows. And it affects a number of people, at least about 1% of the population worldwide. We always think about celiac disease as a gut disease, but there are so many extraintestinal manifestations that may be the presenting feature. And, when one of the things that I do when I am teaching the medical students or the residents or fellows is really think about celiac disease from head to toe. So really can affect any part. There's been reported about 36% of adult celiac patients have neurological findings. And these symptoms, neurological symptoms, can occur even without GI symptoms. So just having neurological symptoms alone, you should be looking for the diagnosis of celiac disease. So there is a huge spectrum of neurological manifestations. And of course, you have the peripheral neuropathy, which truly what people feel is tingling, numbness, burning. And it's quite common, almost up to prevalence is up to 39%. There's gluten ataxia, which is not as common, thankfully, but still present. And it results in some gait instability, poor coordination, difficulties with fine motor task, and really a terrible manifestation of celiac disease with the neurological manifestations. And of course, headaches. I'm sure a lot of people talk about headaches as being their presenting symptom. It often does respond to a gluten-free diet, but again, it's one of those things that you just cannot ignore headaches. So managing with your neurologist becomes important. And with brain fog, there's difficulty in concentrating, and we'll talk a little bit more about brain fog as we go through this session. Epilepsy, there's an increased risk, about 1.4 to 2 times increased risk in patients with celiac disease. And especially if there is some calcification that's seen on the MRIs and CAT scans of the head. Movement disorders, and of course, depression and anxiety. And the question always comes on, is there depression and anxiety a symptom, or is it because of being on a gluten-free diet? And of course, that is something for the clinical teams to work with the patients. So what is brain fog? I think that there are so many different definitions that are used for brain fog. And unfortunately, there isn't one consensus definition. But often people will talk about memory deficits, attention problems, having a mental fatigue, different than physical fatigue, a slowed information processing. And most commonly, the patients will describe more a difficulty in concentrating, forgetfulness, grogginess. But unfortunately, there is no consensus definition. And of course, that's a major barrier to research and drug development. One of the things I found this very interesting study, it was a nationwide online survey that was taken both for patients with celiac disease and non-celiac gluten sensitivity. And it seemed like there was a similar onset and symptom timing across both the groups. So having celiac or non-celiac gluten sensitivity also makes you at a more risk for developing some of these brain fog symptoms. And of course, the impact of this is across cognition, physical, psychological, and quality of life domains. And it seemed to be very similar both for celiac and non-celiac gluten sensitivity. So it becomes important that as we are managing our patients as clinicians, just because someone does not have celiac disease does not mean that they cannot have brain fog. So again, something to remember. So a question always comes on is, why does this happen? Why is it that people with celiac disease end up with neurological brain fog symptoms? So the leading hypothesis is that there are circulating cytokines that are derived from the gluten, and it results in systemic inflammation, and it also acts on the CNS cytokine receptor. So that is the leading hypothesis. But again, there are many other hypotheses that we'll talk about in the next slide. So what happens in patients who have brain fog? Of course, you find these symptoms, but it's also been found that it correlates with the histology and the TTG. So the worse the histology, the higher the TTG seems to be related to the cognitive performance, Because when you go on a gluten-free diet and the celiac panel improves and the duodenal histology improves while you're on a gluten-free diet, there seems to be an improvement in the brain fog. Hence, there is that correlation. Um, and what are the other alternative contributors? So we talk about many other mechanisms, and some of them we kind of think we know, and some of them we don't know, and they're under investigation. So one of the things besides a gluten-free diet that is obviously besides gluten that is a contributor for brain fog, there are thought to be some micronutrient deficiencies. So malabsorption of vitamins like B12, folate, B6, copper, and so on may result in neurological damage. And therefore, we'll talk again later on in this hour about how to help along with the gluten-free diet. So just these vitamins alone is not going to be the answer for brain fog. It has to be in combination with the treatment for celiac disease, which is a gluten-free diet. Other thoughts that have come through that might be contributing to the brain fog is, of course, there's a reduced brain tryptophan, sort of derived opioids that are seen. But again, this is only animal data. There's also a thought that the actual gluten peptides may be having a direct effect on the neural tissues, again, under investigation that might be causing some of these changes as well. Microbiome is always part of what we talk about. Again, unfortunately, no studies yet, widespread studies in humans. But again, there's a thought that microbiome shifts might result in some of the brain fog as well. Lastly, thinking about the actual damage to the white matter in your brain that is seen in patients with brain fog, you might find that the antibodies itself, the anti-gliadin and the TTG6, will cross-react with neural tissues and causes this injury in the brain. Again, all of these are being looked on and studied in many different centers. One of the things I can tell you, we've been looking at my institution at the University of Chicago, looking at two different studies. So one study is looking at adults, where adults who have already been on a gluten-free diet, they went on a gluten-free diet with some symptoms of brain fog, and they are in these studies where they're actually being challenged with gluten, and there are different cytokines, brain MRI, functional MRIs, and neuropsych evaluations that have been done. The study is closed and well, it's almost closed, and there's data that's being analyzed, and some very exciting data should be reported out hopefully in this next year to two. We also have a study going on at the University of Chicago, which is still current and enrolling, is for children. So in children, we obviously will not challenge them with gluten, but these children are being studied who have brain fog and symptoms that of brain fog. At the time of diagnosis of celiac disease, they undergo a functional MRI, a neuropsych eval, and EEG. And then we're following them over a year and a half to look at, again, the same parameters, the EEG, neuropsych, and looking at functional MRI on a gluten-free diet to see if there's a change. So for the children, it's teenagers prospectively looking at them, and for the adults, it's sort of with a gluten challenge. So hopefully we'll have some more data to show looking at these children and adults as well. There was evidence, there was a study done looking at the biobank population. This was looking both at celiac disease and non-celiac matched controls. And it seemed to find that there was a reaction time deficit for people who had celiac disease with brain fog on cognitive testing. There was and extensive white matter tract changes that were seen in people who had brain fog with matched controls. So again, there is evidence that there is CNS involvement, central nervous system involvement in people with celiac disease who have brain fog. So what's a diagnostic approach? So unfortunately, there's no validated diagnostic test. Hopefully, we'll have more studies to actually be able to come up with some more diagnostic tests. So what do we do first? Of course, you've got to confirm the diagnosis of celiac disease, and then you confirm disease activity. As I mentioned earlier, there is an improvement once you're on a gluten-free diet, as you see improvement in the biopsies and as you see an improvement in the TTG, there's also an improvement in the symptoms. So it's very important that people who have brain fog and others with celiac disease, that they actually meet with a dietitian to go through a dietary review, get follow-up labs done. And then, of course, you need to exclude any reversible contributors like vitamin deficiencies, anxiety, depression, and so on. So again, that's part of the diagnostic approach. And then there are objective cognitive testing, and that's where the neuropsych evaluations come in. Functional MRIs and a neurology referral is very important because you don't want to be missing any other conditions that might be causing these same symptoms. So this is a very interesting study that was just reported out from our colleagues down in Australia. So basically what they have done is really try to have a brain fog scale. Very interesting. Started off with really a pilot first step on this study. There was 37 adult patients who have celiac disease were enrolled in this pilot. They went through this 42 item draft. This 42 item was really trying to build on this brain fog scale. And it was, evaluated by these patients. Patients were asked how do they actually talk about brain fog, and there was to discuss their experiences of brain fog. The same 42 items were also looked at by different gastroenterologists, dietitians, and so on. And then the next step was a validation part of it, where there were 510 people enrolled in this second study, all online. And these 510 people who started the next part of the study, they went through each one of these item drafts, and they they scored their brain fog experience, the frequency, they scored their GI symptoms, they also scored any sort of mental fatigue, they scored a lot of different things were scored, and they were scored at what they were feeling then and then the past week. So that was looking at 510 people that went through these. Out of these 510, there were 99 that repeated this study a month later. They took the same sort of test. They talked about what they felt at that time now and the past week. They scored all of that, but 51 of these 99 also completed a cognitive testing. And out of that came through with this 12 item brain fog scale. So the BASS is the brain fog scale that has been formatted. Now, sort of more research needs to be done looking at this scale and also comparing it with biomarkers and so on. And I think there's much more, but very exciting that we actually have a scale that we can look through. So what's the management? The central role is the gluten-free diet, a strict lifelong gluten-free diet. You cannot go away from that. It is really the cornerstone of treatment for all of these manifestations neurologically. Looking at headaches often respond. In neuropathy, there's some improvement. Ataxia might require other medications. There's some recovery to that, but full recovery is not often seen. And again, all the other conditions may improve to some extent, but they do need other help from neurologists as well. What we know is the earlier the diagnosis, the better the neurological outcomes. It really is important that you make a diagnosis early before you actually get all the changes in the brain. Dietary adherence is really important. Histological response also correlates with neurological improvement. So the more your histology improves, the more there is neurological improvement as well. And never forget, it has always to be in conjunction with dietitians, neurologists, psychiatrists, and psychologists. This is a team sport. You just cannot manage this alone. So just to briefly summarize, the cognitive impairment or brain fog is commonly reported by patients, and they usually will say there's difficulty concentrating, memory lapses, memory fogginess. The studies are showing measurable deficits in the episodic memory, verbal influence, and also the executive function. There's cognitive cognitive impairment, which does correlate with the disease severity. There are white matter abnormalities that are seen on the MRI, and the gluten-free diet does help with improved cognitive function. Unfortunately, full recovery is not always achieved, and that's something we all need to remember. And these are just the references. And at this point, I will stop sharing my screen and hand it back to you.
Great, thank you. Okay, so we will move on to the next part of our presentation, which is nutrition focused. So Dr. Verma gave a really amazing overview of what brain fog is and why potentially people experience it. So I'm going to talk about like
what this translates to from a nutrition perspective. Just a quick disclaimer that this is an educational presentation. So if you have individual medical questions, you should address those to your healthcare team. And as we just heard, brain fog is a really common symptom in people with celiac disease. In our iCure Celiac database, over 77% of participants report experiencing symptoms of brain fog at different points. And so we know this is a common question in the community, which is why we wanted to have this presentation. I wanted to kick this off by talking about kind of a hot topic in nutrition, which is the gut-brain connection. The gut-brain connection it describes a bidirectional communication between your gut and your brain, which can impact symptoms. And what's interesting is that when we see, and this is kind of in general GI, not as specific to celiac disease, that increased stress and anxiety can really impact GI symptoms. And there is a physical connection between the gut and the brain, and that can affect how well you absorb nutrients, especially if you're experiencing symptoms of diarrhea or something like that. So, a little bit outside of celiac disease specifically, but just kind of interesting to understand that it makes sense that a gastrointestinal disease would potentially affect the brain, and that psychological distress can influence the gut and symptoms. And so we're learning more about this all the time, but I think we're going to see a lot more research in this area coming soon because it's a really hot topic at all of the medical conferences we go to. I also wanted to point out that there are some inflammatory eating patterns that can contribute to symptoms generally. Symptoms of so following a gluten-free diet, as Dr. Verma said, is the number one way to treat celiac, any symptoms associated with celiac disease. But keeping in mind that some of the processed foods on the market are not giving as much nutritional value as whole foods, so they can be high in sugars and sodium, high in saturated and trans fats, lower in fiber, and lower in vitamins and minerals. And that can be inflammatory and contribute to generally not feeling well. That can also, and we'll talk about blood sugar in a little bit, but can also have an impact on your blood sugar control, which can lead to symptoms of fatigue and brain fog and mood changes. So sometimes the cause of the symptoms, it might not specifically be related to your celiac disease, but could be related to the composition of your diet overall. And so I'm going to talk about kind of different strategies for managing these symptoms. Well, I know that this is a really common problem in celiac disease, and we are going to address that. I just want to also mention that there are some other dietary factors that could be contributing to symptoms that may not be related to the gluten-free diet. So these are just some examples. So we already said this, but I'm going to say it again. The most important thing for reducing any symptoms of celiac disease, but brain fog specifically, is following a gluten-free diet, which means a diet that is free from wheat, barley, and rye. If you've been at any of our webinars before, we put this slide up a lot, which is just to talk about gluten and medications and supplements. I did think this was important to include for the purposes of this presentation because I see a lot of misinformation about supplement regimens for reducing symptoms of brain fog, and it's just concerning. So I just want to quickly remind everyone that medications rarely contain gluten, but occasionally have starches from gluten-containing sources in them. You always want to check the ingredients list. If you have concerns, speak with your doctor, and you can always confirm information from the manufacturer, pharmacist, or some online databases that are regulated by the government, like MedLive Plus and DailyMed. And I'm sure Dr. Verma can help with questions if you have questions about medications. Supplements are not regulated by the FDA like medications. And this is a really important point because they don't have to prove their efficacy or safety prior to going to market. They can use marketing claims that are not backed by science, and the companies that make the supplements are responsible for evaluating their safety. And so I think there's kind of two issues here. The first is that you want to always make sure that the supplements you're purchasing have a gluten-free label on them. But you also want to kind of maybe look at these things with a critical eye to understand if it's really the supplement that's causing improvements in your symptoms. A lot of times it's not. A lot of times they have really misleading marketing claims. And while I think there is a role for certain types of supplements, it's really important that you're working with your doctor and your dietitian to make sure that the supplements are appropriate and safe for you and actually helping you and not just, you know, providing you with a false sense of security. So some key components that I'm going to cover are supporting the gut microbiome, meeting nutrient needs, following an anti-inflammatory eating pattern, blood sugar control, and hydration, because from a dietetics perspective, these are really the key components of management of brain fog. So probiotics. This is something I see a lot, is that probiotics can have a beneficial effect on the gut microbiome, and then that can in turn affect any neurological symptoms that you're having. And I just think it's important to understand that probiotics, by definition, are live microbes that have been shown to have beneficial effects in humans when consumed in adequate amounts. But there are a lot of questions we still don't know the answers to about the quality of them and whether or not specific strains in specific amounts in combinations, right? Every product has a different combination of these strains, whether they're actually helpful for treating disease. And at this point, we don't have that high quality evidence that we would want to see. So there's no evidence for use of probiotics in celiac disease. However, I think it's an exciting area of research, and we can learn a lot from the principles behind feeding our gut microbiome with high quality foods and consuming food sources of probiotics. So I am a big fan of some of these food sources. I mean, kombucha, yogurt, kefir, sauerkraut, fermented pickles, kimchi, miso. These are all food sources of probiotics. They have all different microbes in them. And by consuming these on a daily basis, you can just generally consume probiotics, not have to purchase an expensive supplement. And you know you're getting all of the other nutrients from the food in addition to the beneficial microbes. So it's kind of a good way to just naturally include these things in your diet. Prebiotics are these are basically, you can think of them like food to feed the gut microbes. So prebiotics make the probiotics in your gut grow and proliferate. And most high fiber food sources have some beneficial prebiotic fibers, but these are some of the best ways to consume prebiotics in your diet. So these foods in particular are good food for your gut microbiome. And, some of them are very easy to include on a daily or weekly basis: bananas, kiwis, artichokes, garlic, potatoes, legumes, gluten-free oats. There are more examples, but just including these foods in your diet on a somewhat regular basis can actually help improve the health of your gut microbiome. Moving on to nutrient deficiencies. Nutrient deficiencies can be related to poor absorption when you have active disease like celiac disease, or inadequate intake. And in celiac disease, because of the location of the inflammation, we often see deficiencies in nutrients like calcium or vitamin D or vitamin B12 or folate or iron, and there can be others. And this is one of the key reasons why working with a dietitian is so important for replenishing nutrient stores. It's not just about taking a multivitamin to make sure that you get enough nutrients. We really want to optimize your intake of food sources of these nutrients as well. So this is when someone comes and they get diagnosed with celiac disease, the number one thing is the gluten-free diet. And then kind of right after that, we're looking at how can we restore nutrient status so that you're one, absorbing the nutrients again, but that you're actually getting enough in your diet. So I'm going to go a little bit deeper into some important nutrients for cognitive function. This is not an exhaustive list, but I think it's a good starting point to give ideas for food sources for how to think about some of these things. So iron deficiency can certainly lead to cognitive impairments and fatigue and inability to focus. I think fatigue being the most significant one because you're not getting enough oxygen to your organs. There are many food sources of iron. Some of the best ones are meat, fish, and poultry, but if you don't consume animal products, leafy greens, beans, and lentils are also good sources. Chia seeds I don't have on here as well, but that they are as well. Vitamin B12 is another important micronutrient. It helps with neurotransmitter synthesis and helps with energy, especially mental energy and mood regulation. And there are a lot of food sources. Again, your animal proteins are going to be the best sources, dairy products as well, and nutritional yeast. We do generally recommend that if you are a vegan or a vegetarian, you consider taking a B12 supplement. It's a very common recommendation, but you always want to talk about that with your individual team. Folate is another B vitamin that's important for methylation and neurotransmitter synthesis. Gluten-free foods are not fortified with folate like wheat is, and so sometimes folate can be low in the diet just because wheat is a primary source of folate for people, especially in the United States. There are a lot of food sources of folate. Think green things, all dark leafy greens like spinach and kale, lentils, beans, chickpeas, asparagus, broccoli, Brussels sprouts, avocado, pretty much anything green has some folate in it. So it just, including multiple servings of green things in your diet every day can be an easy way to make sure you're meeting your folate needs. Globally, we recommend that people who are trying to get pregnant or who are pregnant consume a folate supplement just to make sure that you're meeting your needs. Magnesium is a really important nutrient for the nervous system. It has a very calming effect. And it's found in a lot of nuts and seeds. So things like almonds, pumpkin seeds, sunflower seeds, edamame, and spinach are two other plant sources of magnesium. And this is a nutrient where I know a lot of people take supplements. It's a very trendy supplement right now, but I think it's important to recognize that you can meet your needs fairly easily by consuming just a few nuts and seeds on a daily basis. It's not hard to meet your magnesium needs if you're consuming some of these foods. B6 is another important nutrient for reducing brain fog and supporting mental energy and mood regulation. Tuna, salmon, poultry, chickpeas, bananas, and potatoes are all good sources of B6. A lot of times you'll see, because B12, folate, and B6 are all B vitamins, you'll see supplement products that are they have all of the B vitamins in them. Those are fine to take in combination with each other, but again, you can certainly meet needs through food if you're consuming a variety of protein sources and plants. Zinc is another important nutrient for regulating dopamine and symptoms related to focus and motivation. It's found in, again, meat, poultry, and fish, but also whole grains, nuts, and seeds. So there's common foods on a lot of these lists, right? A lot of nuts and seeds and animal proteins have these sources. Copper is another one that is essential for brain function, especially for the enzymes that are supporting brain function. And this is a nutrient that is sometimes poorly absorbed in people with untreated celiac disease because of where it is absorbed in the small intestine. I will say for most people, copper deficiency is very rare, and in people with celiac disease, it will typically resolve once the intestines have healed. You only need a small amount, and it's in a lot of foods, as you see on this slide. So again, shellfish, beef, cashews, sunflower and sesame seeds, lentils, beans, whole grains, dark chocolate, mushrooms, potatoes, spinach. There are a lot of sources of copper and you don't need a lot. So it's one of those nutrients where it's good to know, but if you're eating a variety of protein sources, typically you will meet your needs. Tryptophan is a little bit different. It's not a nutrient. It is a nutrient. It's not a micronutrient like the other vitamin and minerals we've been covering. And a lot of people associate tryptophan with eating too much turkey on Thanksgiving and it making you sleepy. But it serves an important function. It is a precursor for serotonin and melatonin, which are important for mood and sleep and cognition. And I don't see in most of the work that I've done that people have a low intake of tryptophan overall. But if brain fog is one of your celiac disease symptoms, this is probably something to think about more directly. Are you consuming enough of these foods in your diet? Um, One other thing to note is that tryptophan does compete with other amino acids for brain entry. So you want to pair your tryptophan sources with something with some carbohydrates, like turkey with sweet potato or Greek yogurt with fruit. Those are good combos in order to improve the way you absorb tryptophan. But I will say, generally speaking, with tryptophan, if you are consuming a variety of protein sources, both plant and animal, you will be able to meet your needs. This is found in a lot of plant-based sources of protein as well, so really important. Omega-3 fatty acids are, I think, something that everybody should be consuming more of because they have such an important role in brain and heart health. They support brain cell structure, they promote cognitive function, they reduce inflammation, they support mood and mental health, and they help with brain development and aging. And there are two different types. I just put this info on the slide for people to know the different types of EPA and DHA, but honestly, I think consuming both is important. So you can eat, you can meet your needs for omega-3s. I know omega-3 supplements and fish oil supplements are very popular, but for most people, if you just consume um, fatty fish a few times a week and have some nuts and seeds like chia seeds and flax seeds and walnuts and hemp seeds on a daily basis. You can meet your needs pretty easily. For flax seeds, for example, 1 tablespoon a day pretty much meets your needs alone. Same thing with chia seeds. About 1 ounce of walnuts meets your needs for omega-3s. So I think just keep that in. This is like an easy thing to add to food. I think if you've attended some of my nutrient density webinars, you've seen me talk about how adding chia and flax and hemp seeds to things is one of the easiest like nutrient dense options that you can just throw onto your food. It's very simple and is adding a lot of good nutrition. Just touching briefly on polyphenols. Polyphenols protect your brain cells from inflammation, which can help with cognition. Polyphenols are in a lot of foods. They're primarily like think about the colors. Consuming a lot of different colors, you're consuming a lot of different polyphenols. So all your berries, your dark leafy greens, cruciferous veggies. Olive oil and dark chocolate have some polyphenols, green and black tea, flax seeds. So um, I don't necessarily tell people to think about their polyphenol intake, but if it just helps you to think about like more reasons to include some of these foods, there's some it's really exciting to know that there's different nutrients in all of the different types of plant foods and all the colors represent different polyphenols. And so I think just generally including more of these things, it's anti-inflammatory. It's also supporting your brain health. So switching gears a little bit to blood sugar. When someone has low blood sugar, a lot of times that can manifest itself in ways that seem to be more like a neurological symptom. So low energy, inability to focus or think, memory problems. So I did want to mention it in this presentation. The brain depends a lot on glucose from carbohydrates for fuel. And blood sugar fluctuations, like sharp spikes followed by dips, are associated with poor cognition. So in general, you want to have, instead of those spikes and dips, you want to have more of a rolling hills picture when it comes to your blood sugar readings. And the best way to do that is just to pair your carbohydrates with protein, fat, and fiber at every meal and snack. So, if you're having something that's really starchy or carbohydrate based, something like gluten-free crackers, pairing that with something with protein and fat can have a really big impact on your blood sugar and um, will will lead to better blood sugar control overall. So just thinking about paired meals and snacks, what is your carb, what is your protein, what is your fat, and just making sure you have a source of those things with all meals and snack. I have a meal plan example in a few slides, and all of those meals and snacks on that slide are created with this concept in mind. It's not about cutting carbohydrates out of the diet. It really is about strategically consuming them with things that have some protein and fat so you don't have these blood sugar spikes and crashes. And then it seems kind of obvious, but I think it's important to say is that your brain cannot function without adequate nutrition overall. Under eating can leave the brain low on glucose, which is its primary fuel. So if you're not eating enough food, you're going to have issues with focus and memory and mental clarity. So we talk a lot about nutrients, but it starts with eating enough and actually meeting your nutrient needs, because otherwise you can consume all the nutrients in the world and your brain's not going to have enough energy to function. And quickly on hydration, dehydration can also impair brain health. The best practices are to sip fluids throughout the day. That's primarily water, but also diluted juices, coconut water, ginger ale, chicken broth, and herbal teas are also good sources of fluids. And if you're experiencing digestive symptoms of vomiting and diarrhea, it's really important to replace fluid lost. You can consider an electrolyte supplement if your dietitian recommends it, and it includes some sodium and sugar to help you replenish the fluid. We do have another culinary medicine webinar that takes a much deeper dive into hydration. I'm going to ask Emma to share the link to our sports culinary medicine webinar, because there's a lot more to say about this, but I'm going to, in the interest of time, keep moving. And so here are some examples of mood boosting meals and snacks. I basically created this meal plan. It's a 3-day meal plan using the foods that I mentioned earlier in the presentation. You're welcome to screenshot this. It's pretty simple stuff. I mean, you're thinking pretty much your protein, your starch, your fiber, your fat with every meal and snack, eating every 3 to 4 hours, if you are hungry, to give yourself the opportunity to take in some nutrition to help manage your symptoms and get ahead of some of the fatigue that you may experience when your blood sugar is low. And yeah, so I mean, this is just an example. There are many more combinations that would be appropriate, but hopefully that's helpful for you. So yeah, just in summary, maintaining a gluten-free diet is the most important thing, and you want to work with a dietitian to correct nutrient deficiencies, and ideally taking a food first approach. Supplementation might be indicated, but it might not be something that's indicated long term. So it's one of the reasons why follow-up is indicated. You want to eat regular balanced meals to stabilize blood sugar, maintain good hydration status, eat a lot of plants. That's probably the simplest way to think about a lot of the nutrients that I covered, is just eat a variety of different plant foods, and you will probably not be deficient in the majority of these nutrients. You can support the gut-brain connection with fiber and fermented foods to get some good probiotics in your diet. And when possible, choose nutrient-dense gluten-free foods that are naturally gluten-free over highly processed gluten-free substitutes. And before I wrap up, I just want to draw people's attention to our healthcare provider directory. I talked a lot about working with a dietitian and working with a doctor, but I think sometimes people don't necessarily have access to those things, and this directory has hundreds of providers who have identified that they have a specialty in celiac disease and have additional training in celiac disease. So please check that out if you are looking for support from a medical team. And my references will be available when this presentation is posted, which are here.
Great. Thank you so much, both Megan and Dr. Verma, for that. We will get into our cooking demonstration in just a moment. Let me pull that up. All right. Our cooking demonstration is from our medical chef, Sharon Weston, and this recipe that we have for you all today, it sounds absolutely delicious. It is a roasted salmon rainbow bowl with bang bang sauce, and Sharon is actually in clinic right now, and she's unable to join us live. So we will hear from her now on a recording that she shared with us. And the recipe that she will be using today, you can scan this QR code, and I will also put that link in the chat to her recipe in just a moment. But let's get her video up.
Hello, welcome to the kitchen. Today we are going to be making some recipes that are going to give us some great nutrients for brain boosting. We are today going to be preparing a roasted salmon rainbow bowl with a bang bang sauce. And the salmon is going to be a great source for brain nutrients, things like it's rich in omega-3 fatty acids, both EPA and DHA, omega-3 fatty acids, which are great for maintaining integrity of our brain, and also very rich in vitamin D, which is a fat-soluble vitamin. Very difficult to get vitamin D in food sources that are not fortified or enriched. We do get vitamin D from the sunshine, but salmon is a great source of vitamin D, and one serving of salmon can provide us with in between 360 to 900 international units of vitamin D, varying on the type of salmon that's used. Salmon is also a great source of B vitamins, and also, again, rich in protein, especially proteins that are going to be precursors for things like serotonin. And then we also are going to be having health benefits in this recipe from edamame. So edamame is a great plant-based protein. 1 cup of edamame is going to provide about 18.5 grams of protein that is complete and provides all the essential amino acids that our bodies need. Edamame is also not only very easy to use in recipes, you can get it shelled and it comes in frozen bags, and then all you need to do is quickly thaw it. But edamame is great for sources of fiber, folate, magnesium, as well as omega-3s. And then we've got so many different colors in this rainbow recipe of vegetables. Each different color of our vegetables provides us with unique phytochemicals that are going to provide protection from our cells from damage from free radicals, and so acts as antioxidants. Each unique color from our vegetables provides different unique phytochemicals that we really can't get from other vitamins or foods. And so eating this variety of colors of vegetables is really going to also help boost our brain health. All right, so we're going to go ahead and get started here. I have my oven on 425, and we are going to be using the oven to roast our salmon. And so I have here these 1¼ pounds of salmon fillet. The skin is still on the salmon, so I want to show everybody how to remove the skin. All right, if you have not had that removed already. So I have this rinsed and patted dry. I'm just going to start in one corner with a sharp, larger knife, and I'm going to try to separate the flesh of the salmon from that skin. And then I'm just going to use my knife, and I'm going to help separate the skin from the flesh or the meat of the salmon, all right? And so you just have to do this kind of carefully. And once you get both corners started, then, and I like to do this on a paper towel, just so if there's any scales that come off from the skin, that I can just kind of wipe that onto the paper towel, all right? And then once you get it started, you really can kind of pull away. Again, use your knife as a way to separate. And there we go. And so I'm just going to flip this off the paper towel, and I'm going to then work on a piece of tin foil that I have laid out here. Now we're also going to need a baking sheet. I have another baking sheet lined as well with foil that we are preparing to the oven on. What I want to do next is just kind of score the salmon flesh diagonally with some cuts, and this will help to bring the marinade really into the salmon, and will give it a great texture and flavor. So I'm going across first. I'm not going all the way through, but almost all the way through. And I would say that the rows are about 1 inch in thickness. And then I'm going to start in the other direction, again, about 1 inch apart, not all the way through. And I'm just going to score the salmon. This will also make it easier to separate bite-sized pieces into the bowls that we are going to assemble once we have that baked out of the oven. Now I'm going to transfer this to my baker. Yeah, another trick that I have here is that I'm going to kind of roll up the edges a little of the foil so that when we pour our marinade over the salmon, it doesn't roll off and go into the baking sheet. We really want to kind of keep the marinade focused on the salmon. So I'm just kind of making a little, almost like a tray on itself. Okay. All right, and then we're going to go ahead and make our marinade. So I have here 1/4 cup of either gluten-free soy sauce or tamari. And then what we are going to do is add that to 2 tablespoons of honey. Okay. Also, what we're going to add is about 2 tablespoons of olive oil and 2 minced garlic cloves. And then we are going to really stir this up well to get the honey all mixed in with either the tamari or the gluten-free soy sauce, the olive oil, and the garlic. And then once this is really well mixed, we're just going to kind of spoon this over our salmon fillet, trying to get the garlic kind of evenly spread out. All right, that looks pretty good. And again, make sure that the corners of your foil are really pointed upwards so that everything stays and doesn't pour off, okay? And then this is going to basically go in a 425-degree oven for about 10 to 12 minutes or until it's thoroughly baked through. And it really should be about 135 degrees or so with a thermometer if you test that for the fish. Okay, so we're going to put this in the oven. All right, and then we are going to go ahead and get our other ingredients prepared. So for the salmon rainbow bowl, I have here about 2 cups of brown rice, all right? The other benefit of brown rice is that it has more fiber, and that fiber will also help maintain our blood sugar levels more constantly or more consistently instead of rapid highs and drops. And that also can just help us with mood, you know. So I've got here 2 cups of brown rice. You could also use a combination of rice and quinoa for this recipe, and that works great. Then I also have about 4 cups of rinsed baby greens. I've got 1 cup of edamame. I've got 2 sliced green onions. I've got some red cabbage that's shredded here. I've got carrots here that are shredded as well. And so these are all going to be part of our beautiful rainbow bowl. All right. And then we are going to go ahead and assemble our bang bang sauce as well. So the bang bang sauce is going to require about 1/4 cup of mayonnaise. And to that, we are going to be adding about 2 tablespoons of sweet chili sauce. I'm going to add that in. It's like a sweet chili dipping sauce, all right? Also, about the juice of 1 lime, or about 1½ tablespoons. Right, I'm going to give that a stir to just incorporate the lime juice and the sweet chili sauce into the mayonnaise before we add the next ingredient. So the next things are going to add a little more spice, and this is based on your own personal preference, all right? So the first thing we're going to be adding is about 1/4 teaspoon of garlic powder, all right? And then comes the optional. So this is about 1½ teaspoons of sriracha, more or less depending on what you like. And that is really going to make the bang bang sauce just give it a little more heat. All right. Again, we're just giving this all a stir. Okay. And so we're going to start to assemble our rainbow bowl. I have here a large bowl here, and in the bowl we're going to start with the base of our baby greens. You could also use spinach, you could use cooked spinach or sauteed spinach if you wanted to not use raw lettuce. And this is about 1 cup should go in your base, all right? And then we will go ahead and add all of the parts of our rainbow. So starting with our red tomatoes, I'm going to add in here. And then I'm going to add orange carrots. The yellow peppers. I'm going to add the green edamame. And I'm also going to add the cabbage for our purple. Okay. And then our carbohydrate source will be our brown rice. So that's going to be about 1/2 cup serving. And then our salmon will be coming out of the oven in a minute, and we will be placing that on top, served with the bang bang sauce on the very top. All right, so our salmon is now out of the oven and really nice and golden brown on the top. The garlic is just nice and crisp and well cooked through with the fish. And so this is going to be perfect to place now on top of our rainbow bowl. So I'm just going to take a serving of about 3½ ounces and put that right in the center. Yum, smells so good. And then I'm going to top it off with a little green onion. And I'm also going to drizzle the bang bang sauce over the bowl. And this looks so delicious. You can also add a little salt and pepper if you want. And just to top it off, And we have a very beautiful brain boosting meal set forth here. And I hope you enjoy.
All right. Well, that concludes our presentations for the webinar. Thank you to all of our speakers today for their expertise on this topic. And before we get into answering some of your questions that came in during the presentation, we'll only have time for just a few. I do have our post-event surveys up on the screen now. I will also put those in the chat. If you could just, like we did in the beginning, take which survey applies to you, and we would really appreciate this. This would help us continue to improve the program moving forward. And like I said, those links are also in the chat. But let's get into answering some of your questions. We did get an interesting question on testing frequency for micronutrient deficiencies. So, how often should celiac disease patients undergo micronutrient testing?
I
Yeah,
think
do you want to
that,
start?
when it depends on the time of the diagnosis. So the first few years after diagnosis, obviously we do it more often, which can be anywhere, depending on if you're a child or an adult, but at least 3 to 6 months. And then sooner, if there are any abnormalities and you're making some changes with your diet or supplements or anything like that. Once all the labs, like your celiac panel and everything else, is normal, and all your micronutrients and vitamins are normal, then once a year, one should have labs done. Obviously, having a conversation with your clinical team if your diet changes for whatever reason. You change in children as they're growing and adults as they go from one age to the other. It might change, but on an average, at least once a year, once you are in a stable sort of place, I would say. From a clinician standpoint, Megan, what do the dietitians say?
I completely agree. The other reason to make sure you get it checked annually, especially if you've been taking a supplement, is you want to make sure your blood levels aren't too high. I have seen that happen where people have been taking high doses of something for a long time, and then we have, it builds up in the body and it's way too much. So that's especially important if you're taking any sort of supplement.
Absolutely. Thank you. Another interesting question, I think this is important to address, um, is are our nutrient deficiencies completely solved with a gluten-free diet? I think there's a few different nuances to that question, but interested to hear your thoughts.
Yeah, I mean, I can start. I would say the short answer is no. You also need to be consuming those nutrients from your food. So it's one of the reasons that I mentioned how processed foods are not as nutrient dense as whole foods. That's one of the big reasons we push intake of whole foods so much, is that if you're not consuming these nutrients, you're not going to be able to correct a deficiency. So usually it's a combination of supplementation, but also optimizing the diet with food sources of nutrients so that eventually you don't have to take a supplement is often the goal, not always, but yeah, it's not just because your inflammation heals, you can absorb the nutrients, but if you're not taking them in, it's not helpful.
Mhm. Absolutely. And one final question, Megan, this is probably a great one for you. Sources of omega-3s, specifically for people who have shellfish and fish allergies, what should they prioritize instead? I know you covered this a little bit, but
Yeah, flax seeds, chia seeds, walnuts, hemp seeds. Soy products do have some omega-3s, so that's just a tablespoon of those seeds every day can help you meet your needs. So yeah, I think that's and there are, people who follow vegan diets can certainly meet omega-3 needs. So it's not just for people with fish allergy or shellfish allergy. Yeah.
Mhm. Absolutely. All right. Well, that unfortunately does conclude the time we have for Q&A. But thank you again to our speakers for being here today and answering those questions. As I promised earlier, these are the instructions again to obtain your continuing education credit for attending. And like I said, if any questions do pop up, please feel free to reach out to us and we're happy to help. But once you create your account through Boston Children's, you text that code provided to the phone number to record your attendance today. And thank you all again for you joining us today. And we hope that you'll join us for our next culinary medicine webinar, which is going to be on weight management and celiac disease, which is scheduled for Tuesday, October 6th at 3 p.m. Eastern, 12 p.m. Pacific. And we hope to see you at any of our other virtual educations sessions that we offer, which you can always view those at celiac.org. But thank you, everyone. Have a great rest of your week.
Thank you.